we serve as not only an example, but we're taking care of the community in whole. And what better way to serve our community to let everyone know when they bring their loved one to us for heart surgery, for hip surgery, for an emergency, for delivering of a baby, that you're going to be in the hands of people who 100% will have been vaccinated and minimize the risk of transmission of this disease to your loved ones. That's such an important statement. It overrules almost every other thing you can say about this. It really is an important thing to do. But when people read things on the internet or from their cousin or from some other anecdotal example about outcomes that were less than optimal for the vaccine, I would take that with a grain of salt. What I would do, I would talk to your doctor. 97% of the doctors in our community are vaccinated. They must believe in it. And so if you have a question, talk to the people who take care of you already and get their opinion. The people who post stuff on the internet are sometimes just absolutely trying to fearmonger, and I think that's wrong. I'm not going to ever encourage censorship. That's wrong also. But just take those stories you hear with a grain of salt and realize that you should talk to your doctor about it. And I think that's where the decision should be made. I absolutely felt wonderful and almost tearful to the point when we received our vaccinations. It was in the midst of a terrible time. I had a good friend of mine that died literally within 2 weeks of that first vaccination, who would have loved to have had it. Dr. Shadowin would have loved to have had this. There are thousands in our community who would have loved to have not died because of this disease. And I feel that they would be reaching out to us right now and saying, prevent this from happening to thousands more. I just felt that we were starting a great thing at that point. I felt like a Superman. I mean, it was just amazing, the fact that you're now protected from this disease. And we were seeing it so often. We were head to head with people multiple times a day with the disease. It wasn't like it was a happenstance. All of us in the ER were just seeing it every day, and we are again now. And to have this protection around us is very comforting, and I'm very grateful.